My name is Zita Ficko. I am a urologist at Marble Valley Urology. I am originally from Slovakia, and in Slovakia you have to choose what you're going to do when you're 16 years old because you have to start getting ready to apply for university. When I was 16, I thought, yeah, I may want to do medicine, I may want to do economics. I wasn't quite sure what I wanted to do. My parents are both in economics and management, so they figured they're going to try to scare me. So they arranged a shadowing opportunity for me at an emergency room, just thinking I'm going to go there and faint and, then I'll go and do business just like them and then they'll all be happy. Well, as you can see, that kind of backfired because as soon as I set foot in that emergency room, I knew this was it. I knew this was for me. This is where I wanted to be. So that's when I decided I wanted to be a doctor. So I came to the US when I was 18. I did my undergraduate at Yale University and then I did my medical school at Dartmouth. And I really like this area of the country. So I stayed for residency at Dartmouth. And then when I was looking for places to practice, I really found out that the population I enjoy working with is the population of rural Vermont and rural New Hampshire and rural New York. It's the stubborn farmers that are my favorite, and this is where they are. So this is where I am. Urology is a field people don't like to talk about. It can be very private, it can be very embarrassing for people, but it is very important and really affects their life. We can make such a huge difference in people's lives with really small surgeries, which is what really drove me to urology. What I like best about practicing in urology is the amount of change we can bring to people's lives with just really quick surgical procedures. When I see somebody in the emergency room who's in excruciating pain from a kidney stone, my surgery is 30 minutes, an hour at most, and it completely transforms their life. I am very happy with the level of collaboration at Rutland Regional Medical Center. I take care of a lot of cancer patients, so I work very closely with the Foley Cancer Center with both medical oncology and radiation oncology. A lot of our bladder and prostate cancer patients end up needing all three modalities, and we have tumor board every Tuesday. We talk about all the patients. We stay in touch when things are changing. For example, imaging shows something new and unexpected. I've been very happy with the level of collaboration and subsequent patient care at Rutland Regional Medical Center. When I'm not being a doctor, I'm being a mom and a wife. I have two children. They're twins. They're 6 years old now, so they're taking up pretty much all of our free time. But we like to take them outdoors. We like to ski, we like to skate, we like to hike. So if I'm not in the office, you're gonna find me up on some mountain. What I like about Rutland Regional is that it's neither too big nor too small. It is the perfect size. We have all the latest technology, and if I want to bring a new technology in there, very responsive in letting me have it and letting me use it here. So I'm very satisfied. The one piece of advice I have for everybody is blood in the urine is never normal and you should get it checked out. It could be anything from kidney stones to the bad stuff, the kidney cancers, the bladder cancers, and please don't ignore it and get it checked out. I've seen a lot of patients with pretty advanced pathology because they've been bleeding for months and months and they were hoping it's gonna go away, and all that did was just let the cancer spread further. Patients are very comfortable here. They come scared and they leave reassured and they leave happy. So I'm very happy working here.